Climate and Health Equity webinar. My name is Tiffany Troxler. I'm Associate Director of Science at the Sea Level Solutions Center in the Institute of Environment. And I'm here with Dr. Genesis Ramirez and Myra Cruz, and we've partnered on this webinar to provide you some of, sort of an overview of some existing activities and information related to climate and health equity. And I'm going to pass it over to Dr. Genesis Ramirez. Thank you for joining.
Thank you, Tiffany. I'm Genesis. I am with the FIU Office of Engagement, and I also help to manage a tri-county coalition called Life Sciences South Florida. Some of you may already have heard about us, but basically our goals are to recruit, retain, and develop talent in the region. We do this by doing our best to avoid brain drain or reduce brain drain. So our goal is to keep our STEM students here in the South Florida region, either going to graduate schools at our universities or by finding professional positions in industry here in South Florida. I'm so excited to have you all here today, experts on climate and health equity, to discuss such an important topic. And so I'm excited that we have this panel going and for our attendees to be able to ask questions and interact a little bit with us. I will also share that you can find our previous webinars and this webinar recorded on our Life Sciences South Florida Facebook page. So if you have to leave early or if you want to refer friends to watch this later, they can just visit our Facebook page and check it out there. And you can also join us next week, 1:30, for other webinars, which will be posted also on our Facebook page if you want to continue to follow our series. Thank you so much, Tiffany, for partnering with Office of Engagement and with Life Sciences South Florida on this webinar today.
Great, and let's give Myra just a brief second to introduce herself as well before we get started.
Thank you, everyone. Really happy to be here with you all. So my name is Myra. I work at Catalyst Miami. I'm the Climate Resilience Program Manager there. And I've had the immense joy to work with everyone on this call, on this webinar as partners on the Climate, Health, and Equity Coalition. For short, we call it Check Miami. But our goal as a coalition is to build power and a just society and really having an eye for improving health and wealth for all of our residents here in Miami-Dade County. But we're super grateful to all our members that have been part of this effort since last year, which many are on this webinar, like Florida Clinicians for Climate Action, the CLEO Institute, FIU, the Miami Foundation, and the Medical Society Consortium on Climate and Health. So thank you so much, and you'll hear from me soon again.
Hi, everyone. My name is Marie. I'm with Sea Level Solutions Center in the Florida Institute of Environment. We're going to go ahead and launch a quick poll. We want to see what you think about a couple of questions here. So in your screen, you're going to be able to see a poll. So you can click on them. And the first question you should be seeing at this moment is I am. A single choice means you are going to be able to select only one answer. The second question says, the type of business where I work is. You have a couple of options here. So just select the one that fits right for you. So for those who are watching us live on Facebook, we definitely invite you to join us. You can sign up on the link and still register to participate in these polls and in their Q&A features. Can you all see the polls popping up? All right, so we're going to go ahead and do the third question. What are the three most important things that determine your quality of life? Here you can select a couple answers. This should be a multiple choice. Okay, so you have health, family and friends, happiness, freedom, learning and education, religion, being outdoors, connecting with nature, work-life balance, safety, or security, or a good paying or job. I hope everyone's being able, oh, great, I see the first vote, wonderful. All right, and lastly, we have, what are the three most important concerns you have about sea level rise and flooding? Again, this is a multiple choice. You're able to answer whatever feels right for you. I'm just gonna give it a couple more minutes for you all to answer. We have about 8% has voted at the moment. Thank you for all of the people who are submitting their answers. I'm gonna give you guys a couple more minutes. All right, and you have about 1 more minute.
Yeah, we have a couple more minutes than that, Madi, if you want to give people a little more time to fill out the poll.
Sounds good. So if you're just now connecting, welcome. It's good to have you all here joining our panelist discussion. We definitely want you to participate in this Q&A. So if you're watching us through Facebook Live, we definitely invite you to go on Zoom, register, and you'll be able to participate in the polls. And you'll be also able to participate in the Q&A by submitting your questions. And our panelists will be able to answer your questions, whether it's live or also through text. All right, so we have 4 questions here. The first question everyone should be seeing is whether or not you're a student. The second question is, where do you work? If you're a private sector, government, nonprofit, self-employed, or if you're not working. Third question is, what are the 3 most important things that determine your quality of life? And we have about 62% voters. Thank you so much for submitting your answers. And the last question is, what are the 3 most important concerns you have about sea level rise and flooding? But here you can select multiple choice, so select those that apply to you. Okay, this is great. We have a lot of responses. Thank you so much. And I'll definitely share with you all what our audience right now is thinking. Okay, I'm gonna go ahead and end the poll. Do we have, how many more minutes do we have for this one?
We have 2 more minutes.
Great, thank you. Okay. So let's take a look at what our audience answered. So most of our audience are non-students. Then we have a lot of people from the government and nonprofit organizations, but also private sector. What are the 3 most important things that determine your quality of life? 68% of you responded health, 65% said family and friends, and 45% said happiness. All right, let's take a look at the 4th question. What are the 3 most important concerns you have about sea level rise and flooding? So we have a 48% on both answers: impact on community, friends and family, lack of awareness, and no action to address it. And then we have a 45% of exacerbation of social inequities. Then we have another 45% on water contamination and public health impacts. And our 5th question, what are the 3 most important concerns you have about other impacts of climate change? We have a 58% increased heat and extreme heat. We also have 45% on impacts on public health and lack of awareness and no action to address it. Great. Let's take a look at the 6th question. What do you think are the 3 highest priority initiatives or actions that can be done to reduce the impacts of climate change and improve your quality of life? So we have a 61% says increase use of renewable energy to reduce climate change impacts. And we have a 48% that says increase city or community green infrastructure initiatives like tree planting, vegetating swells, and increasing restoration of coastal habitats. All right. Well, my apologies, I don't think you were able to see the responses, but you'll be able to scroll down now and take a look at those responses. All right. I'm going to go ahead and stop sharing this and we can move forward. Thank you for submitting your answers. And now I would like to introduce you to Myra Cruz and Dr. Cheryl Holder, who will be starting our presentation on climate health and equity. Dr. Holder, would you like to start?
All right. Good afternoon, everyone. I'm Dr. Cheryl Holder. I'm faculty associate professor at the Herbert Wertheim College of Medicine. And that was a great poll because it showed what we're important to us, which is our health, our family, and happiness. And all that is directly related to our climate. And I got into this climate world when my patient came in. I had one of these aha moments, and her name was Anime. And I changed her name, and that's not her picture, but she reminds me so much of her. So when I saw that picture in the stock, I said, that's my Anime. And Anime, she walked in just for refills. And it sounds so simple. I just need medication refills. And she was a 64-year-old woman, had lots of disease, blood pressure, diabetes, high blood pressure, asthma, and COPD. And she was a little overweight, and she was on multiple medicines, and she just wanted a refill. And towards the end, I'm like, okay, tell me more to refills. And then she says, do the refills, and I need you to sign this form for me. This form was a Florida Power and Light form. She needed help on her light bills. And this got me understanding more of what climate and health really means. Because it wasn't as simple, I need refills. It's why did she need refills and why couldn't she pay her bills? So that got me really looking at what was happening in 2016. Around that time, we heard it was the hottest year, the hottest time. And I started educating myself and hearing more about what happens when the sun is coming on our planet. What is causing it to not radiate back out and not level that temperature, why it's so hot. We'd heard of climate change, we'd heard of global warming, but it sounded like it was something so far off. It wasn't something now, and it wasn't impacting us. It's more a polar bear problem. But here I had Anime telling me she's breathing problems. She couldn't sleep at night because it was so hot. She couldn't pay her light bill because she was running her air conditioner more. And she lived in an old house in Opelika. So we learned more of what's happening with the sun coming in, heating up our planets. And so what's causing all of this? Greenhouse gases. So what are those? So I'm like, okay, we know all about the factories, but Anime didn't live near factories. But we found out that transportation is the #1 factor. And we know what's going on in Miami, especially in the neighborhoods that Anime lives and other of my patients live. Lots of roads crisscrossing, lots of highways, lots of trucks going through. So transportation was sending up the greenhouse gases, producing electricity. The industry, and in Opelika, there's a lot of industry. So we realized that too much carbon dioxide being trapped in our atmosphere is creating like a blanket over an entire world that is heating us up. And not only that, okay, next one, we found out that all that pollution and communities like Miss Anime's community, we see are living in more exposure to pollutants. See, at least Black communities, 35% more exposure. Hispanic communities, 20% more exposure to pollutants than white communities. The housing are just disproportionately inadequately prepared to deal with the heat, to deal with the cold. The energy burden, the average household of Blacks and Hispanics that pay for electricity or any energy cost for heating is tremendously more than the white communities in the same cities. Next. We also learned that if you look at Hispanic communities, they live in counties where the ground level ozone is 50% higher. Major employment for many Hispanics and also for low-income Blacks, agriculture, manufacturing, construction. And if you think of the Hispanic community again, most live in states that are already experiencing serious effects. Where do Hispanics live? California, Florida, Texas. So I was seeing in my population when I was taking care of my patients and where I worked in Opelika and North Dade and where I worked throughout Miami-Dade County, this is the population I care. So she couldn't pay her bills. So what do we know? That on average, Black communities, for every dollar that a white person works, Black communities making 59 cents on the dollar. The Hispanic community, 73 cents on the dollar. American Indians, 59 cents on the dollar. And if I threw in education, say, oh, well, everybody isn't as educated. We know that even in education, that disparity in income for the same level of work persists, where an educated Black person with a college degree is making 85 cents on the dollar for a white person. So you're compounding being exposed to pollution, having health issues, and then not having the economic power to be able to care for yourself. Next. So what happens with all of this heat and what's happening in climate change? It impacts us in 4 major ways. Directly, the heat, like my patient Anime, pollution, like my patient Anime, directly also through extreme weather. We also see with the heat, we're seeing a change in the mosquitoes and other insects that are coming into warmer climates. And we already know about the Zika and the dengue. And most recently, we heard of West Nile virus, 2 cases. Disruption of water and food supply. That's another major way that we've seen that the heat, which is causing the plants to grow faster because there's so much more CO2 and plants use CO2 to grow. So as they grow faster, they're not as nutritious. And because of the heat, we're also seeing where different areas are becoming desert and that less food production. We just saw major locusts in parts of Africa, which then decimated their crops. So we're seeing the disruption of water and food supply. You'll hear more about sea level rise and things that happens, which then drives the water and backs up our ability to grow foods. And most importantly, there's a disruption of our emotional well-being. We have increased stress as all these factors come at us too. And heat itself causes some changes. Next. So I like to think of it, and we use mnemonics, and you can use this mnemonic because it tells you exactly the biggest things that we just talked about. Heat wave. Think of heat wave, heat illness, exacerbation of heart and lung condition, asthma, traumatic injuries. When these storms come through, you're gonna have more injuries, water and foodborne illnesses, allergies, vector-borne diseases, which we talked about, emotional stress. But for the rest of these slides, a few slides I'll go through this again, and you'll get the message to see that is happening now. Many of us are being affected more. This one shows the big organ areas that pollutants can affect. It's in your brain, heart, lungs, all the varying diseases. We talked about it. Exacerbating your heart and lung disease. As the temperatures go up, you have different problems with your lungs. Your heart rate also changes. You get dehydrated. We see increased we see heart attacks, we see strokes, just a myriad of health issues. Next one. The lungs are the big issue with pollution and heat. And I show you this picture of a child because you're gonna see the most vulnerable people that are impacted by this. We talked about the one, Miss Anime, who was an older woman, the next group of children. They're closer to the ground. Ozone, which is one of the greenhouse gases in the pollution, is lower to the ground, which then triggers a lot more asthma. Next. And asthma, we see again, who's affected more. 1 in 9 African Americans, 1 in 7 Hispanics. I talked about the trees growing faster, the more pollen, the more allergy season starting weeks earlier. We're seeing all of this affecting our children and folks with allergies. Next. One thing that's interesting is that despite poorer people and minorities getting impacted more from all the climate and all the greenhouse gases, they're less responsible for producing these gases. Pollution, huge. COVID is the severity of COVID is very related to pollution also. These are the little particulate matters. And this has shown that if you live and have longer exposure to the pollution, you will have a higher death rate. And in Florida, we see more Blacks being affected by COVID and dying from COVID compared to the rest of the population. We talked about heat in heat wave, the first one, heat illness. Who works outside? We know Latins work outside. We know other groups work outside. Heat illnesses is major. This one shows a tornado, but it takes us to hurricanes. As we come into hurricane season, we know that the climate impacts the hurricane even more. And as this slide says, it goes primarily through a lot of poor communities. The mental health issues are tremendous also. And this patient, this is not my patient, but she had a fight with her daughter over a fan, which took her to a jail. When she was just released from jail, she died 3 days later because she returned to her hot apartment. Mental health is serious. These are some great slides that you'll have some that shows the direct link of mental health issues and temperature. Dr. Carissa Caban shows a way of dealing with the emotions. So as we see the increases, we're now finding solutions how we can deal with the emotions in the mental health. Zika, this was one of my patients, Maria. Vector-borne diseases, again, the V in heat wave. Mosquito bit her, transmitted Zika, which can cause the microcephaly in babies, and depression because she had to receive. The vector-borne, these mosquitoes are moving up. It's no longer just Southern Florida. We're seeing all the way North Carolina and higher. We're going to start seeing these diseases. Next. Sea level rise as the water gets moved in. The next one. As the water moves in, these are the communities that we anticipate having a lot of difficulties with. The greens and the light greens are only 5 to 6 feet, 3 to 5 or 6 above sea level. As the sea rises, it pushes the water into our sewer systems and backs up. So septic tanks, poor communities are going to deal with flooding. With flooding comes nutrient-rich water, which is basically bacteria and other things that can hurt families and hurt your children and cause diarrheal illnesses or skin rashes. And this is what we're beginning to see, really concerns about the pressure on our septic system and the bacteria that will happen. We can even now find COVID in our water system. So what does this all mean? Next. This slide is just showing that I just went through the major factors in heat wave and what are we as clinicians and doctors who are on this can do. This is just to show you just so many things because there are solutions out there. Next. So in actuality, we're happening now. Climate change is impacting our health. There's some folks more vulnerable than others, older people, children, folks who live near in these communities, poorer people who often don't have the resources to impact their changes. We can do things. Healthcare practitioners out there, we have got to come together to make that difference. Now I'm going to turn it over to Myra, who will talk about one of the things that our CHECS program is doing. Thank you.
Thank you, Dr. Holder. That was a great recap of all the major climate health impacts, and that was really illuminating. Thank you. So yes, our CHEC Coalition, since last fall, we've been working together to create surveys to really get to know from the community's perspective, from the healthcare perspective, from those that work in government, what are the things that concern you the most when it comes to climate and health? And most importantly, how can we address those issues? What are the solutions that you have in mind to improve climate and health impacts in your communities? So this is still in the early stages, but we created this survey and we're able to pull out some solutions and concerns from what we heard back in terms of feedback. So some of the things that we can do are to implement solutions around like green spaces and infrastructure, more in education and awareness, to improve healthcare access and equity, to have funding for these solutions. Money really matters for this. To, like you all said, clean energy and solar energy, that's a big way of improving our health outcomes and really getting around those co-benefits. So one thing I'll just say is that, we really want to ensure that the solutions that CHEC comes up with are driven by you all, that is driven by the people that are on the ground that are experiencing these problems. We're here to help, but really the experts are you. It's you that is on the ground that are experiencing these impacts day to day. So we're here to ensure that we can implement these solutions, to work on these together, to refine them together. So I'm sure that you'll hear from us again as we refine all of these ideas, and we'll be coming back to you in the fall with our theory of change and our proposed solutions to workshop that all with our community members and with all of you. So thank you so much. And we're really happy that you're part of this conversation. You're definitely on the right path to helping us get at these solutions.
Thank you so much, Dr. Holder and Myra. So let's take a look on how did we do. Let's go ahead and launch a poll. So you should be able to see on your screen in just a couple of seconds a poll. So let's go ahead. The first question you should be seeing on your screen is a true or false question. Climate change affects everyone's health, but some people are more vulnerable than others. Go ahead and answer. What do you think? The second question you should be seeing is which of the following populations are more vulnerable to climate health impacts? This is also a single choice response. Okay, and our third question is which of the following is not an impact of climate change on our health? I can already start seeing some questions coming in, some answers. Thanks again for voting. Okay, for this one, we do have a couple of minutes. You should be able to see 4 questions on the screen right now. The fourth question is also a true or false. Carbon dioxide is a greenhouse gas. Is it? Is it not? You can answer in the polls. All right, we have about 58% has voted. I'm sure we can get to a higher number, 63%. Right, I'm gonna give you about 1 more minute to answer these questions. And if you are watching us on Facebook Live or any other social media platforms, you're welcome to register on our Zoom link. And that way you can participate in the polls and the Q&A features as well. All right, and let's take this last minute to answer those questions. We have about 70% have voted. Can we get a little higher than that? I'm sure we can. All right, let's go ahead and take a look at what we think.
Oh, kitty cat.
Let's go ahead and share your responses here. All right, we have some really great answers here. So yes, true, climate change affects everyone's health, but some people are more vulnerable than others, as Dr. Holder and Myra told us. For number 2, which of the following populations are more vulnerable to climate health impacts? People who lack financial and social resources. We have all the above. Yes, all the above is correct. We also have the elderly, pregnant women, infants, and children. We also have people with existing heart and lung conditions. Let's take a look at our third question. Which of the following is not an impact of climate change in our health? Increased exposure to cigarette smoke increases the risk of lung cancer. That is not a factor of climate change. So for question number 4, true, carbon dioxide is indeed a greenhouse gas. Thank you guys so much for sharing. All right. And now we're going to go ahead and introduce Dr. Susan Jacobson. She's our guru in our citizen science projects, and she'll be talking to us about that. Go ahead, Susan.
All right, thank you, Marie, and many thanks to Dr. Holder and Myra for really amazing presentations. So we wanted to ask this question of how hot is it really in Miami? So we have the citizen science project that's trying to find out. So FIU Sea Level Solutions Center, the Department of Journalism and Media, and Catalyst Miami launched a citizen science heat event called Miami Shade. FIU students, faculty, and Miami-Dade citizens deployed tiny heat-sensing eye buttons around the county in areas where residents are most likely to congregate, such as bus stops, public parks, parking garages, and in other areas, because sometimes there's a difference in the kind of heat that you experience depending on exactly where you are. On this slide, you can see a map showing where the buttons were placed. We placed buttons in locations ranging from Aventura to Homestead. Okay, next slide. So every neighborhood has different characteristics: the size and locations of buildings, the presence of concrete and asphalt roads and sidewalks, the number of trees, the presence of water. They all have an impact on the temperature that people actually experience in their daily lives. More buildings, concrete, and asphalt may make your environment hotter. More trees, grass, and water features may help cool it down. We have a map that shows the average daily high temperature readings we recorded around Miami-Dade County from June to September 2019. So if you click on a pinpoint, you can see the temperature information. So the darker the little red dot, the hotter it is. So you can see here the average daily temperature at this location was 103 degrees, which is very hot. So if we want to know, well, obviously it wasn't that way all over Miami. Where is this? So let's click on the photo where it says the contextual photo of the location. And we see it's a bus stop. It's a bus stop around 30th Street in downtown Miami. And also, if you want to see what the I button looks like, if you can go back to the map. Okay, and let's click on the close-up photo of the I button on that one. It was a good one. So go back to that one. Okay, hopefully this is the same one. This may not be the same one. Okay. Oh, there it is. Okay, that's what they look like. So they're very small, and so they're easily, they blend in easily with the environment, which allows us to collect up to 3 months of data, which we then download and analyze to try to determine how temperature varies around Miami-Dade County. Okay, so if you would like to measure heat in your neighborhood, let's show them the sign-up form. You may sign up here to be part of our brigade of citizen scientists and place a heat monitor in your neighborhood. We're planning to place the sensor soon, and we will contact you with more information if you fill out our form. Thank you. And I think this is a QR code that takes you to the form that you can fill out. It's also on our website, which is MESAN, MESAN.Miami.
Thank you, Susan. All right, now the moment we've all been waiting for. Let's go ahead and ask some questions to this wonderful panelists that we have here. We also have Mona Safarti, and we also have Olivia Collins and Melissa Baldwin joining us. Myra will be moderating this panel discussion, so I give you guys the floor. Thank you so much.
Thank you, Madi, and thank you, Susan, for all of that. So yes, we have a great panel of experts here. Melissa Baldwin, she's a program manager with Florida Clinicians for Climate Action. Olivia Collins, director of programs with the CLEO Institute. They're a nonprofit that work on climate education. And Dr. Safadi, who's a director with the Medical Society Consortium on Climate and Health, and Dr. Holder once again. So we know there's been a lot of questions that have been coming in. So we'll just get started, and please continue to use the Q&A function, and we'll do our best to get to all of them. But we know that there's a lot of burning questions out there. So I will just get started here. So one of the questions that came in from the registration is, how can we integrate or approach this dialogue that we're having now around climate and health in our workplace to increase awareness? And I will just put this out to Dr. Holder first.
Integrating this question, it's always easiest to start from yourself. Everyone at this point must have been impacted by climate in some way. If you go back and think, if you have allergies, just like when my patient came in and it was an aha, that it wasn't just that she wasn't taking her medicines correctly. There was a whole lot of things that was happening in her world that's making her use her medication more and causing changes. So when we complain about the heat, or we're noticing that they're cutting our grass more, I don't know if you have a landscaper, but they do have to come a lot more, and you have to cut your trees more, and the cost, linking it back to climate. And then having folks realizing, how can I link this back to climate? And if I have high blood pressure and I got to go deal with that heat, that's going to change my blood pressure control. What am I eating? How can I make that change? Because I recognize the climate. There's solutions. As you talk about it, talk about your Meatless Monday. So there are ways that it's always best when you can relate to yourself and tell that story about what you know is happening to you and anyone else in your family and how you can find a solution. Always leave with that solution, whether it's Meatless Monday or Walking Tuesday. There's something you can come up with to show them that this is possible and is something we can handle. And also that there's some folks who are more vulnerable. And what are we going to do to make a difference for all of us?
Thank you, Dr. Holder. Is there anything else that the rest of our panelists would like to add to that? Go ahead, Olivia.
Sure. Thanks, Myra. And thank you, all these wonderful women on today's webinar and those who have joined us today. I would just like to add that at CLEO, we do a lot of education and we target different audiences, basically everyone in the community. And it's really important to just meet people where they're at. Dr. Holder did a really good job at showing how climate change is a threat multiplier, which means it impacts every single aspect of our lives. So no matter where we work, we can probably link climate change to something in the workplace. And so just better understanding your audience and making it relevant to them is a great starting point. I just want to point out that the Yale program on climate change communication does some great studies, and they've discovered through surveys that most Americans believe climate change is happening. They believe it's happening to them. It's personal, but only 4 out of 10 people are talking about it. So one of the first steps you really need to take is get educated on this subject and then talk about it with your community, friends, and your family.
Thank you. I'm glad that you followed up with the great work that CLEO is doing. And just, I'll do a shameless plug for you, but CLEO has a slew of new programs coming up. So definitely, I'm sure we can send a link to CLEO's website, but shameless plug for them, definitely sign up, especially if all of this is getting you really excited, you want to get involved and learn more. I would definitely look into their programming. This question I think is super pertinent, so I want to pose this to the panel and specifically for Melissa to start out with first. But with COVID-19, people are expected to be at home, self-isolating, quarantining, but we know that some of us may not have access to AC or can't keep it running this entire time because of the costs related to that, but it's hot out. So for Melissa, if you can get us started, like what are things that people can do while they're home and self-isolating and may not have access to AC or be able to afford it at this time?
So great. Thank you so much for that. I think that when we're looking at the solutions, I'm really happy to see that with the CHECK program that we're looking at green infrastructure because trees are super important. And so looking at how we can develop in green infrastructure, that's a multi-solver. So it's an opportunity to reduce carbon emissions and to create cooling, but it also can be a job creation and economic stimulant. So that's a really important program. The other thing that I wanted to tell people about that they might not be aware of, there's 2 different programs that can help people in terms of actually helping their homes go more green, helping them reduce electricity. So there's 2 different programs that can help people to get more air conditioning. There's something called the Weatherization Assistance Program, and that's a program that's available in Miami-Dade County. And then there's also SELF. So SELF is a new program. It's a green bank, and they help low-income people get access to financing for energy efficiency retrofits. So they can help you get solar panels, they can help you put a new roof on, they can help you get new windows and doors. So that's a new program that can be available coming to Miami-Dade County. So those are 2 different programs that are available to help low-income people to go green. And that's really important because when we look at climate change, we look at carbon emissions, we see that the building infrastructure, that's a huge component of carbon emissions. And so when we're reducing the electricity use in homes, we're helping people, or improving quality of life, we're creating jobs locally, and we're reducing carbon pollution. So these are some really good programs that we can look at specifically in Miami-Dade County.
Thank you, Melissa. Yes, that's a great point. And I think oftentimes it's green infrastructure that we're all interested in, but sometimes there's a disconnect between what we want and what maybe the government or maybe the Army Corps of Engineers might be suggesting for solutions. I think just tying it back to being engaged and staying on top of things, it's super important to make your voices heard on these solutions so that we're implementing what you really want to see in your communities. Is there anything else anyone else would like to add around this particular question?
Hi, can you hear me?
Yes,
so that was, I think, very on target. I'm delighted to be here. This is just a terrific session. It really is. So much good thinking, and it's a pleasure to hear what others have to say about this. One other approach that may or may not be feasible for local communities around the Miami area, depending upon what's available from the local government, is that some communities have established public resources for extreme heat so that people who have poor air conditioning or who have more medical conditions and are in greater danger have someplace to go when the heat maxes out. So Philadelphia, as an example, has a program where when the heat alerts kick in, the buses become free. And the buses are all air conditioned. And so some people can essentially cool off by just getting on to the buses and riding around in an air conditioned environment. They also have cooling centers that people can go to. And so they tend to be located in places where there are more elderly residents. And if you look at the pictures who comes to those cooling centers, it tends to be older people, but older people also have less thirst drive, sweat less, and actually are people who more frequently succumb to extreme heat. So, these are solutions that really require being involved with government, but to the extent that you have local organizations that are involved, this is something that they can raise as, solutions, short-term solutions, or even longer-term solutions for people who are in danger.
Thank you, Mona. And that was a really good segue into this question that we got, which is, you mentioned Philadelphia, for example, what are other models that exist from other cities around the country, or even maybe internationally, that, have had effective funding, that have proactive programs that operate at this nexus of climate and health? And this person in particular did want to hear from Dr. Troxler, from Tiffany, if you want to take a stab at it, just to put you on the spot, even though you're not an official panelist. You really are, though.
I think probably I think we all saw a webinar recently where there's been some work going on in Arizona. We know that extreme heat is a significant problem there. And but I think I would leave it to the climate and health experts to talk about their experiences in terms of understanding where else good work is happening.
Thank you. Yeah, Arizona does have a great climate and health program that they've been running there that you can look up. Dr. Holder or anyone else?
The intersection to really link it, I can't say in South Florida we have done that yet. And that's one of the things we're working towards with Florida Clinicians for Climate Action, to really bring it together. In terms of decreasing greenhouse gases, Health Care Without Harm, that's a group that's working with hospitals to reduce waste. And there's another program, My Green Doctor, that helps clinicians in their offices to decrease the use of, to increase renewables, to be more energy efficient, and also to recognize what we can do for our patients. So there's some things that are done locally that we're seeing. Internationally, we're seeing a lot of countries taking on to stop single plastic use, like Rwanda has done that for about 4 or 5 years. Ethiopia is planting millions of trees to combat the erosion problem. And we know that then links into any climate solution is a health solution. So even if it's not specifically labeled a health solution, we know by having more trees and green and more green infrastructure, we're going to decrease the heat, which then decrease the triggers for the chronic diseases that people will have. Because what climate does, you say, accelerates and it amplifies existing problems. And hopefully so solutions will increase health. I see Mona has some comments.
Yeah, thank you. What you just said reminded me that it's really important to talk about how air quality interacts with the heat, because when the heat rises, if there's both heat and sun, the ozone levels increase. And so the heat, of course, can be potentially fatal. The ozone levels can add another stressor for people's lungs and airways, and the lining of their eyes as well. So ozone is related to the heat, and that has a direct impact on health. If it gets high enough, it affects everybody. If it's just elevated and not maxed out, then it may only affect those who have asthma or an underlying lung condition. But if it gets high enough, everybody's at risk because of it. And so that I love the description of these eye buttons. I think that's just absolutely brilliant. And I hope other locales figure out how to do their own local studies on, on what the heat is like in different parts of their city. And I think, if that were mixed with a measure of the air quality, then there's the basis to go to to city authorities and say, look, when we have these maximal heats and poorest air qualities, we should be actually closing traffic. We should be turning certain streets into pedestrian streets. We should be making sure that we don't have so much pollution in the air that not only are people in danger from the heat, but they're in mortal danger because of poor air quality. So these measurements, citizen scientist approaches, actually getting a handle on what's going on the ground in different areas, can really make a huge difference and can set the stage for getting other solutions that are, that involve.
The American Lung Association has the website stateoftheair.org, and you can put in your zip code and find out how much pollution, what your ozone level, and how much pollution is in your community by zip code. So that's another way to get data. And so we can all be citizen scientists, but we do need data. And luckily there are apps and sites that you can get this information to see what's happening in your communities.
Yes, I love that. And it's related to another question that came in related to education and communicating science. I'll throw this out to Olivia first. So what can we do to improve science communication surrounding these issues, and particularly for those that are most at risk in their communities?
A great question. And, again, CLEO targets all communities, especially the most vulnerable. And again, I just want to thank Dr. Holder for painting a really clear picture about what those vulnerabilities are. And I also want to mention that according to the ALICE report, 60% of Miami-Dade County residents are considered poor or working poor, which means already their socioeconomic positions make them more vulnerable to the exacerbation of climate change impacts. So one thing that we do is we meet people where they are. That's the first way of reaching people. Rather than having them come to you, we go to them. We try to reduce the barriers so that they can attend some of the workshops that we put together. So providing childcare, providing food. And when we're talking about hurricane preparedness, for example, we provide items that they can start building their kit with. But more importantly, how we communicate it is we put it in the most simple terms possible. We don't need a lot of science to understand how climate change works and how it's already impacting our communities. So keeping the message short to the point and just reducing as many barriers as possible to be inclusive as possible. And I just want to mention what all of you were talking about previously. Miami-Jackson Hospital has a climate change committee, and that's a really interesting way that it's all volunteer, it's all healthcare workers that work in the hospital. They're looking at their waste, they're looking at the impact the physical infrastructure of the hospital is having. So not only they're trying to reduce the emissions of the hospital, the impact on the waste, but also for the patients that they serve. So that's another way that healthcare workers can get more involved in policy, is by creating those volunteer committees within the structures that they work.
Thank you. Yeah, I totally concur with that.
CLEO didn't mention, but they do a photo where they have the kids take photos of their communities. And so I think anything that involves the community in collecting the data, in identifying the issues, help takes this message clear. So you can, if anything you can apply immediately is what learning is all about. So if we involve more of the community to see it's happening around them, we can then get more action.
Yeah, you know, one other point I want to mention about the air quality and how that plays into all this. I think what Dr. Holder just said is absolutely right. That it's really important to involve the community. I'm based, our organization is based at George Mason University in Virginia. And there's a researcher that has been doing work on air pollution and the distance to roads. And it turns out that the air pollution is much more intense if you are within 200 meters of a road compared to being 200 meters away from a road. And so they've just done an amazing job of putting together that data to show how much difference it makes, whether you are really very close to a road or further from a road. And so that's another thing that can be locally measured and then utilized to activate the community.
Thank you for that. One question came in about our sewage systems. That's something that Dr. Holder, you mentioned in your presentation. I think, I know from the work that we've done with our community engagement, oftentimes people aren't aware about how their septic systems can be impacted by climate change. I think oftentimes there's that misconception that only coastal cities will be impacted, only those that are at the water's edge, but that if you live further inland, let's say you have a home in like Miami Gardens, for example, and you're on septic, there can be major public health impacts due to that sea level rising and flooding that happens. So can you speak more specifically about areas in Florida that are especially vulnerable to these sewage problems due to septic tanks being old or decayed or waterlogged, and what communities are already impacted and what we might be able to do about that? It's a big question.
Yeah, I don't have all the data, but I know there are over 100,000 tanks, and the older communities along like North Miami, Alapata, El Portal, those areas have a large number of septic tanks. And there's now research, the county is doing this analysis as we speak, is my understanding, because this question's come up in committee in other places. And they're doing the analysis on how many septic tanks, the age of the tanks, and what are the best responses. The Army Corps of Engineers did a huge study, and that was part of the issue that was evaluated. Their $4.6 billion response is a little bit concerning for many of us in the equity world because so much of it ended up being spent in Aventura and Miami Beach, which then left the poorer communities again without as much dollars to solve some of these issues. So this is being analyzed. Most of the tanks I know in Dade County are not new, and most will be affected with the sea level rise. So the county is doing the evaluation right now, and I'm not sure which committee, but between CHEC, we're looking at that also. And I know Dr. Traxler, sea level rise, they're also evaluating that information, but it's being evaluated now because that was part of the Army Corps' issue. I don't know what the final solution in septic will be, but most of the money did not come into solving that problem.
Thank you.
If Traxler has anything to add on septic. Or if Dr. Obi is around, he knows a lot.
Tiffany's coming on.
Yeah, no, I'll just say that the county's getting ready to release a follow-up to their original report to try to define some solutions for septic.
Thank you. So I think we have time for maybe one or two more questions at most. I'm just keeping track of time. So someone asked a question, systems, you know, is there a way that we can change policy to require that cooling systems are in all government or government subsidized housing in Florida? Is that something that we can do or something that others might already be working on? And I'll just leave this open to everyone.
When you're saying air conditioning government housing, most of the housing is federal dollars. And the federal mandate is for heating. And unless the federal changes, what Miami-Dade County has done is get separate dollars to try and retrofit most of the housing under their control. Now, much of the subsidized, not subsidized housing, but much of housing for lower income goes through Section 8 vouchers at this point. And so they go into the private world and they get subsidized. Now, that's the area where there's most vulnerability because the federal dollars and some of the programs are upgrading infrastructure for those housing, but much of the housing is in the private world. So that's becomes, again, legislatively, who's your county official, ask what your county commissioners are voting for. And you are going to have to help advocate for a lot of the low-income people in Florida because they don't have the power, but they are the ones who are most vulnerable. So when you're voting, it's not just what you're going to get, but if you really want this issue, it is with the private landlords in having them upgrade their buildings. And then FPL to say, how am I going to help my poor people? Because having air conditioners is just one step. My patient had AC, but she couldn't pay the bill because it's so high. So there's going to be more equity in how much she pays on her bills.
I want to add to that. I really agree with this point. I think that that's a big problem in Florida, that we have so many people who don't have air conditioning. You would think it would be required to survive in Florida. But there's two things. One is that at Florida Clinicians for Climate Action, we are developing a medico-legal partnership, and that's where doctors team up with lawyers to advocate on behalf of patients. And so right now, we're looking at a successful program that they did in Jacksonville, where they were able to change local municipal code to require screens. And that's another issue in Miami, right? Because if it's hot and you open the window and you don't have a hole in the screen, then you're vulnerable to vector-borne diseases. So that's one opportunity. So clinicians that are engaged with us, we really want them to work with us on that medico-legal partnership. And medico-legal partnerships are done on other topics, but now there's an emerging group of professionals, both in the legal and health world, that are teaming up specifically on issues about climate change. That's number one. Number two is that I think it's time for us to put more pressure on our public utilities, on our investor-owned utilities, the electric companies. Another solution is just making sure that electric companies are doing their part. So when you compare Florida to other states, we have ridiculously weak, low energy efficiency goals. And so there's something called the Public Service Commission, and that is the body that regulates our public utilities. And in Florida, we have set goals that are extremely low for energy efficiency programs. Now, utilities, they are in business to make money, and they need to generate, investor-owned utilities have to generate a return for their shareholders. So they don't want to sell less electricity, but we know that energy efficiency is a huge part of the climate solutions. It's the cleanest, cheapest, fastest kilowatt hour is the one that we do not use. And so we have to lean on our lawmakers, our governor, and the Public Service Commission to really enact better and stronger goals. And just to give you a specific example, FP&L, they have suggested the weakest low income program out of all of the investor-owned utilities. So if you compare them to Duke or TECO, the other utilities, they have offered a program that helps the fewest people, and the people who it does help, it offers very small kilowatt hour savings. And so I think it's time for us as advocates to really think about how can we ask our lawmakers to hold utilities more accountable, to do more of their part, to help low-income customers to have energy efficiency, because they can fund those programs to have that weatherization assistance. And there are some good examples. TECO actually has an okay program, but right now Florida's going through that goal setting process that only happens once every 5 years. So it's a little bit in the weeds, but it's actually a really important solution. Energy efficiency is, the biggest piece, one of the biggest pieces of the solutions puzzle. So definitely holding utilities accountable and holding our lawmakers accountable to enforce stronger energy efficiency through our utilities.
Thank you, Melissa. That was such a great way of kind of connecting like the solution to the problems. What can we do the most here with all of this? So I know we're almost out of time. We are out of time. But thank you all for all your thoughtful responses to these questions. And, you know, I'll just say the conversation doesn't end here. We hope that you'll take this back home with you to your workplace, to your school, wherever it is that is your community. Please make sure to continue having these conversations, and hopefully it was thought provoking, and now you're, you know, ready to get into action. We have elections coming up, there's the census, there's so many things you can be doing, and we'll definitely make sure to plug you in where we can. So I'll hand it back over to Mari.
Great, thank you, everyone. So just one last poll for today. Mari, if you can open up the satisfaction survey. And this is a reminder slide. If you hadn't had a chance yet, please use your phone if you have that to get this QR code. It'll bring you directly to the sign up page for participating in our next citizen science heat monitoring event. So just two questions very quickly. How would you rate today's webinar? One answer, please. I enjoyed it, high five. There were some aspects I really liked, but not everything. It was okay, could have been better. Terrible, a waste of my time. I don't know, prefer not to answer. And one last question related to whether you'd like to participate in an upcoming citizen science event. Please answer either yes, no thank you, or not sure. So if you could take just one more minute of your time to complete this satisfaction survey, we would very much appreciate it. And Madi has just advanced to the final slide of the webinar, where you can also participate in the Climate and Health Equity Coalition survey. You see there are 3 QR codes, and depending on your sector, whether you're a healthcare professional, a community member, or a public sector or official, you can grab that QR code or use those links to fill out the poll that or the survey that we're putting out to the community about climate and health equity. So thanks everyone very much for participating, and here we go. Mostly high five. Thanks everyone. And great, Susan, look, we have some candidates for our next citizen science event. So thanks everyone, and have a wonderful day.
Thank you, everyone.
Thank you. Everybody. Thanks to our panelists.
Yes, y'all rocked it. Thank you.